My name is Dr. Patricia Kapunan. I'm a pediatrician, Montgomery County Public Schools parent, and the new medical officer for MCPS. I'm excited to introduce myself today and share a couple of thoughts as we prepare for the new school year. The medical officer role is a new position for our school system and one that will be dedicated to school health issues. You may wonder, what is school health and why does the school system need a medical doctor? One thing we have learned over the course of the COVID-19 pandemic is that health and education are deeply connected. Mental and physical health are important factors that can affect how students learn. We have also learned how important it is to consider health and safety in our learning environments. And more than ever, we recognize the importance of the health and wellness of others in the school community who make learning possible. Teachers, administrators, and the school staff whose work is absolutely critical in how we care for and teach our children, as well as the health and wellness of parents and other family members whose engagement in education is also key to our shared success. Having a school physician on staff will help our community be more proactive, comprehensive, and intentional about addressing the health and well-being of our students and staff as it relates to our educational mission and environment. Now, addressing the impact as well as the ongoing potential risks of COVID-19 in our schools will be an important part of how we continue to do this work together. Going into the fourth school year since the onset of the COVID-19 pandemic, MCPS is absolutely committed to providing in-person learning with safety and equity in mind. We have come a long way with COVID-19 prevention and management, and now have multiple tools we can use to keep learning going, including vaccination and mitigation strategies like testing, facility improvements, and masking. How we use these tools to continue in-person learning will come with opportunities and challenges, as we are one of the largest school districts in the country, with nearly 160,000 students in 210 schools and more than 24,000 employees. The way we plan work, use our shared resources, and apply strategies will be aligned with the needs of our students, families, staff, our resources, and our priorities. The way we apply strategies and use our resources will continue to change as the science and epidemiology of COVID-19 changes. Two things I want to share and reinforce with you today about how we will continue to plan for COVID-19 are communication and collaboration. We're taking a good look about how we communicate about COVID-19 to the school community. This includes offering health information relevant to our school community, sharing data in a meaningful way, and educating staff, students, and families about policies and procedures. It includes communicating in a timely way and continuing to create opportunities to listen to each other. Communication, especially two-way communication, is important for the second item I wanted to discuss, which is collaboration. How schools plan for COVID-19 is influenced by many factors: regulations that govern school spaces and resources, expert medical recommendations from agencies like the Centers for Disease Control, and guidance for schools for the Maryland State Department of Health and the Maryland State Department of Education. The Montgomery County Department of Health and Human Services is a very important guiding partner for us, as they are not only our local public health authority, they staff and run our school-based health services, as well as offer health services for everyone in our community. It can be complicated to interpret multiple directives with guidance coming from multiple levels, and that will be one focus of my work, helping school leaders and the community interpret what current rules and expert guidance means for our school system specifically. The collaboration challenge is implementation, meaning how we work together to apply new science and new guidance in our school space. This work requires the shared expertise of our school staff, students, families, and other community stakeholders who represent and support them. It requires improving not just how we communicate, but the relationships and structures in which we work together. We are continuing to look at how we can improve processes in this area and build trust together. As MCPS shares more details of our school reopening plan, incorporating updated guidance from the state and the CDC, we expect to receive input from the state, DHHS, and our school community that will help inform how we implement this plan. Planning will need to be proactive and flexible as COVID trends and science continue to evolve. Our team is closely monitoring the situation in collaboration with DHHS. We plan to communicate frequently to our school community and build systems for authentic collaboration. As a parent myself, and having personally witnessed in my work as a clinician the pandemic struggles and triumphs of hundreds of parents and children, I understand the need for trust and transparency in an uncertain time when we simply want to do the best thing for our families. Finally, let's remember that health and wellness is about so much more than COVID-19. We need to think about mental health and active health promotion. As a physician, I can't stress enough the importance of getting back to the basics. Good sleep habits, healthy nutrition, physical activity, all of which lay the foundation for our overall health and well-being. We need to work toward a shared definition of wellness that includes these basics, approaches physical and mental health within a prevention framework, and resonates with everyone in our community. Thank you for spending this time with me today. I look forward to doing this important work with you. And until next time, be well.